Welcome to the Mindful Table with Health Empowerment Coach Joanna Mickel and myself, Maame-Mensima Horne, Naturopathic doctor and clinical hypnotherapist, where we discuss natural approaches to health and wellness with an emphasis on being mindful. Today, we are going to be talking a little bit more about women's health. And this episode is inspired after, so I was on social media and I saw a post by Lupita Nyong'o talking about in 2014, she was diagnosed with uterine fibroids. And through my education, I've had a number of my colleagues who were also impacted in dealing with uterine fibroids. So it actually is a topic that I have done some research, and not just research, but looking at ways that we can support women in reproductive health, looking outside of the conventional model and utilizing tools, holistic tools, naturopathic tools, and also looking at how other medical fields like Chinese medicine and East Asian medicines look at fibroids, endometriosis, and other reproductive health um, conditions because in those fields, we actually are not looking at the diagnosis from the Western perspective, but we're looking at patterns that may present with the individual, the patient who comes into the practice or to see us. So today, that's what we're going to be talking about. We're going to be talking about women's reproductive health. We're going to be talking about our own experiences with reproductive health, and then also like ways that we have in our toolkits that can help women with our reproductive health. All right, so Joanna, it's nice to see you. And I would love for you to kind of get us started and you could share a little bit about why this is an important topic for you and also why you would like to talk about this today.
Well, one of the things, is a big kind of crux for me is I am big into women's health anyway. I see the struggles in women that have come to me as a health coach, um, and just the frustrations that tend to happen with just going through our the transition from starting menses in our teens and then having dysmenorrhea during our 20s and 30s, trying to have children, people battling endometriosis, PCOS, fibroids, all those things, and then they get into perimenopause and menopause and everything seems to blow up again. And so all of these things are happening to women and there's just not enough support, research, and things. It's just it's like a new a new medicine in a sense, because there's so much misunderstanding, lack of knowledge, understanding how the hormones work, and all of the environmental factors, right? Stress, toxins in our environment, that play a role. I know myself, I battled dysmenorrhea in my 20s, and I would be pretty much put out for a day where I was just in so much pain. I wanted to chop off the lower half of my body. And then I was also, there was no regulation. I never knew, when it would come. I was also one of those, I could call myself Dr. what is it? Miss Dr. Jekyll and Mr. Hyde. That was like my switch between when it was that time. It was like, I'm going to eat somebody alive or I'm really nice. So, these are the things. And I didn't really know, we just thought that's normal.
Mm,
Oh, you're gonna, you hear that a lot. Oh, women, it's women. They're, they just are hormonal. They're this and that. They're, and when I found for myself when I started, eating right for my body and moving my body the way it was, I just happenstance upon this by, doing not really, I was just trying to get healthy, so to speak, because I, was in chronic pain and all this stuff. And so I started following the blood type diet and I started running and all this stuff. And it was like night and day, to see the shift in me. I had regulated my menses. I had no pain. I had no shifting in my moods. And I was like, all that is not normal. That's when I realized this isn't normal. All that I
Mhm.
went through in my 20s is not normal. And so that's when it started changing me to realizing there's a better way. People need to know that, how we eat, how we move, how we deal with stress, all this stuff plays a role in how our bodies respond and the emotions and the hormones and all of this stuff. And of course, in Chinese medicine, I've learned what, I was dealing with. I was dealing with a lot of qi stagnation, blood stagnation in the body. And I had naturally started moving it by eating the proper things that were allowing my spleen to work appropriately, dealing with emotions and things so my liver chi could work appropriately. So, it's nice that I can kind of put words in the understanding rather than, oop, I happenstance upon it. Woohoo! Hopefully others can. So that's kind of been my journey, and why I have such passion for women's health is because of the struggle I went through. And I've also, with some of my family members, struggling with fertility issues and things like that. And thankfully that they've been able to have children. But, I have a heart for women to have not feel like I'm going crazy all the time because my hormones are going all over the place. I'm in pain. I can't, so being able to help them to find that, to what are those approaches. And I'm glad to be in, studying Chinese medicine to be able to, give it a better and clearer picture, because in Eastern medicine, again, it's just a diagnosis and no real substance to help.
Western. Yeah, in Western medicine. Yes.
Yeah.
Yeah. So, like I think you hit on a lot of things that I feel resonate with me as well. So it wasn't even in my teens. I started menstruating like around, let's say 10.
Mm-hmm.
And I had also dysmenorrhea, painful periods, menstrual
Mm-hmm.
cycles, um, for most of my early cycle.
Mm-hmm.
And it was so painful. At one point, I was given, what was it, the prescription Motrin, so 800 milligrams of ibuprofen and 1600 milligrams would help relieve the pain. So that's a
Mm-hmm.
lot of Motrin,
Yeah.
at a very young age.
Mm-hmm.
And, you know, as we're studying, especially my first year of naturopathic medicine, it was at the Canadian College of Naturopathic Medicine. We had as well Chinese medicine as part of the curriculum. And our instructor for Chinese medicine, he specialized in women's health. And he would say, that's when I learned that these things weren't normal.
Mm-hmm.
And like painful menstrual cycles is not normal, excessive
Mm-hmm.
bloating, things like that, that's not normal.
Mm-hmm.
And thankfully, I'd already had the move towards healing. um it was like the first time I had no pain after like during a cycle was actually the only time that I actually did like a prolonged fast. I was caught up in, I had a colleague who did like the I don't know, there was one of the fasts where you just drink apple cider vinegar or water and all kinds of stuff. The lemonade, whatever they call it. I couldn't do that because I was just like, that
Mm-hmm.
just is, it's torturous. But I did do a flush. So I flushed my system with salt water. And
Mm-hmm.
then I drank tea for, I think it was like 36 hours. That was like it, because I was just like, I can't do this. But that was the only time that, well, I should say that was the first time, very first time that I did something so extreme.
Mm-hmm.
And the result of that actually was I had pain, like no pain my next cycle. And
Mm-hmm.
then all of a sudden there was a shift, right? So a massive detoxification process created a shift. And then when I was vegan, I didn't really have painful cycles, but I also learned that like having very light cycles is not necessarily healthy as well, right? And that was for me. So it's interesting because 2014 was a year of pivot for me where my health shifted. And what I was noticing was even though I wasn't having pain, around my cycle, what I was having is what they call PMDD, or the premenstrual dysphoric disorder. It wasn't diagnosed, right? But what I did notice is that I was having these severe experiences that were not normal, but it
Mhm.
was right after, like it was like right before my cycle would start, I would just kind of
Mhm.
like lose touch with what is going on. And a
Mhm.
lot of women have these
Mhm.
experiences. It's kind of weird having conversations with people who reach out to me for different reasons, telling me that their hormones are creating some severe mood swings, and then
Mhm.
also anxiety, or for some
Mhm.
people, it's even like delusions and other mental health
Yeah.
exacerbations. And what I recognize is that for a lot of us, that our menstrual cycles, number one, I do believe that it is one of our vital signs. So
Mhm.
whether it is very painful, whether it is too light or too heavy, and that was another thing that I was
Mhm.
experiencing, was severely heavy menses.
Mhm.
And so outside of my period of being vegan, my menses were pretty severe, to the point
Mhm.
where when, like, I would say 2 years before I graduated from naturopathic school, I took it upon myself to start measuring my menses, because I
Mhm.
was going to the acupuncture clinic in our school, and I was just like, okay, like I know that there's something that can be done, so I want you to show me. So I started using the Diva cup to measure, and my menses were over, like well over 100 milliliters a
Mm.
month.
Yeah.
Yes, but I didn't have pain, but I had
Mhm.
like severe anemia.
Mhm.
And I mean, I learned that when you have anemia, and we learned this, right? When you're
Mhm.
deficient
Yeah.
and anemic, your body, so in Chinese medicine, if you have like a spleen qi deficiency, so the spleen does not have the energy in order to work properly, you actually will
Mhm.
have abnormal bleeding, because the spleen, like in Western medicine, we know that the spleen actually like is where it's where blood cells go to be
Mhm. Recycled.
processed. I would say processed, right? They're going to be recycled.
Yeah.
That's where the ones where they're getting old, they go, and then it kind of gets they get metabolized, and then the parts get reutilized or excreted, right? But the
Mhm.
spleen, if it's deficient in Eastern medicine, that is where you may actually have excess bleeding. So having anemia, and then also having this deficiency of energy that holds, that creates our energy and holds the, like,
Mhm.
helps with the blood
That's
and the
me.
creation
Mhm.
of blood. Having that deficiency actually made my cycles even worse. So we know that. We see it on the Western side that anemia, you will see heavier menstrual cycles. So I started
Mhm.
eating liver. I
Mhm.
was eating liver 2 to 3 times a week, and then I
Mhm.
was on a herbal formula. And my cycles actually significantly shifted to where, I mean, now my
Mhm.
cycles are under 70 milliliters, which to me
Mhm.
is like, what? How can that even be possible? When
Mhm.
2 years ago, my cycles, and then yeah, 2 years ago they were like disturbingly high. And if
Mhm.
I'm not eating appropriately, so if I'm not getting enough of the micronutrients, I will
Mhm.
easily go back to having heavy cycles, and then I'm
Mhm.
energetically depleted.
Yeah.
Yeah. Yeah. It's, women's health is unfortunately not it is not studied because in the history of Western medicine, because traditional medicine goes for thousands of years, and women
Mhm.
have been involved in medicine previously, but especially with Western medicine and the development of the scientific and professionalism of medicine,
Mhm.
there has been the elimination of women early on, where even women like used to birth life, right? When we
Mhm.
birth life, it's women who are helping women bring
Lives.
the children into this world. But now, what the medicalization of even birthing, childbirthing, what we
Mhm.
see is even trauma in those experiences. I mean, my mom, like today, I was talking to my mom, and
Mhm.
I may have shared this, but I may not have. But like with the work I do with hypnotherapy, a lot of the work that we talk about is birth trauma, right? And
Mhm.
so in my current training that I'm doing, which is a group training, we're working through birth trauma. And I keep trying to say I worked through that, right? Because
Mhm.
I was talking to my mom today and she was telling me about like my when she was pregnant with me and the things that she was
Mhm.
doing. But for her, the
Mhm.
most traumatic experience that she had during my birth was actually bringing me into this world, right? Her hospital
Mhm.
experience and being able to have a natural birth and all of that. So she
Mhm.
had so much trauma about that, but not throughout the pregnancy. And so
Mhm.
when like as somebody who works on birth trauma, and it's like even I'm like, I'm pretty happy-go-lucky. I know my mom's pregnancy, I've always felt this strong bond between us.
Mhm.
And I only like and for me, it's so weird being in medicine.
Mhm.
I had to work through what I call medical trauma, and I didn't understand where it was coming from, but my birth is where it came from, right?
Mhm.
So when we're looking at the medicalization of and the professionalism around medicine and taking practices that were traditionally women supporting women to bring in new life,
Yeah.
going into the extreme opposite, a sterile environment, which has its pros, right? Because we know that due to medical errors and things like not just medical errors, but there's always risk to everything that we do. There is also
Mhm.
medical errors but there's also like the coming into this world does have some level of danger, right?
Mhm.
Um, but
Yeah.
by taking and creating an environment that is borderline hostile, right?
Mhm. Yeah.
I mean, it's unfortunate, it's sad to say this, but it is kind of a hostile environment where people who do want to have natural childbirth, sometimes, especially in the 80s, where, you know, it was big, the C-section culture became the norm. It was pushed highly. So, like, even something like coming into the world becomes hostile. And so, for reproductive health, we are carrying a lot of that trauma and those experiences that used to be female centric, where women were
Mhm.
supporting women and the knowledge and the experiences were shared. There
Yeah.
used to be like
Mhm.
they call them moon circles or gatherings, or when I was in Ghana, I so we were in a more remote area, very traditional,
Mhm.
and I was on my cycle, and I was asked to leave the home because of some of the traditional aspects. But I was sent to a grandma, and then the
Mhm.
grandma was supposed to. She wanted to, she was going to take care of me and all this stuff. And then they actually sent me to a hotel because they were like, oh my God, this girl's from America. She needs to be comfortable, all this stuff. So for me, my experience was like, oh, I'm on my cycle. I'm going to be taken care of. I'm being pampered. I get to, they sent me away so that, I
Mhm.
could be comfortable. But really, the elders were there. They wanted to help support me.
Mhm.
So, like having that experience, which is totally different from our current experience, is it a
Mhm.
surprise that we're having so many reproductive issues
Mhm.
when the community and the support that was traditionally there for generations after generations after
Mhm.
generations within the last 100 years have been removed,
Mhm. Mhm.
you know?
Yeah, I'd say
So,
it's probably been longer than 100 years because, shifting into that mindset. Because I know what started the whole hand washing was in women's health. Dr. What was it, Samuel Wise with hand washing. I can't remember if that's the doctor, but he was ridiculed because he said, stop. you need to wash your hands before you go birthing babies after doing, surgery. And he did, because it was causing pelvic inflammatory disease on these women after having children, and they would die. And so the mortality rate in his delivery room was dramatically lower, and so women wanted to go to him, at that time. And this was at the late 1800s. And he started saying, hey, you need to wash your hands. You're contaminating these women, going from one, working with somebody over here and going over there. And they laughed him down into scorn until they realized, oh, that's true. And of course, he ended up dying of infection due to some issues. But that's the thing, is the whole understanding wasn't there. It's just like, oh, whatever, for women. And so they'd already shifted away from having midwives that were working, with the women and stuff, and took them away from that traditional role, which is necessary. Women needed women. That's the community, because that's what helped them to understand how to know what their body was doing, was the experiences of the other women. What man has an experience of what's going on in a woman's body? He doesn't
Yeah.
know. And then they didn't really even research it enough. And so that's the missing link, is having that ability to talk with others, to say, what was my experience? I've been seeing some news articles coming out talking about trauma, cesarean trauma, where the women are actually feeling all the pain. The anesthetics are not working. And so now there's fear. And that's why there's this big shift away from cesarean, as much as possible, which can be, detrimental sometimes in certain cases. But I do think that they, like you said, during that C-section culture of the 80s and even a little bit before, it was, let's just jump to there, and do C-sections. And now they're like, whoa, whoa, whoa. And they're realizing that's really harming the child too,
Mm-hmm.
because a natural birth is what really helps in development, especially of the lungs, the GI tract. That birthing is very important. And then there's also in some emotional medicines and mind body medicine, when a child is not allowed to go through the vaginal birth, they're kind of stunted in any obstacle. They think they have to have help through life. They have to have help everywhere, every step of the way, because I had to have help coming into this world, so everything must be difficult for me to do. And so, there's a balance between, when do we utilize cesarean, and when do we allow that birth to unfold? And sometimes we're putting women in positions that are not conducive for birthing anyway, trying to lay them
Yeah.
on the back. We never did that, in
Yeah. We should be
traditional places.
squatting.
Yeah,
Yeah,
exactly.
because it's just the muscle, the
Mhm.
walls actually get
Yeah.
shorter when we squat. There's just so many things. I'm like, oh, like so many thoughts. But yeah, like
Yeah.
also, yeah, I know in our training, well, in the hypnotherapy training, one of the things that we talk about is, so there is two aspects. One is that not being able to overcome challenges, but then there's also this expectation of, yeah, people doing things for them, or not being able to rise to the occasion, right?
Mhm.
Because when the aspect of coming in through the birth canal, it is there's the push, there's a push, and then there's a relationship. It's like a dance between the mother and the
Mhm.
the infant, going together, working together, where the baby has to actually be part of it. They have to squeeze through this narrow canal, and then they are supposed to take this breath, and the
Mhm.
change of environment. And there's just so much to it. I mean, like,
Yeah.
my imagination just goes wild when I think and visualize it.
Yeah.
But without that, yeah, you often find the struggles, the challenges of dealing with the day-to-day life. And
Mhm.
in addition to that, I like what you said when you were saying that, yeah, women need each other. And we see this, there's a lot of shift into modernization.
Mhm.
I remember when I was younger, like my girlfriends, like the
Mhm.
phone calls would just go on forever, but the need for
Mhm.
community, right?
Mhm.
There
Mhm.
is a need, there is that community support where healing happens in community, in circle. And,
Mhm.
when we look about where we look into, I don't necessarily, because I don't look into things black and white as in the masculine and the feminine, because
Mhm.
when we look at the Taiji, the yin yang symbol, we see that there is yin within yang and yang within yin, and that there's always a constant motion where the yin is becoming yang and yang becoming yin, and it's a relativity, not an absolute. So there is no true absolute that this is one thing, this is another thing, but we see it culturally where who goes, like, why is therapy such a big thing, right? It's because of the need for community. And
Mhm.
in the past, that therapy was actually happening in the groups. And in traditional
Mhm.
cultures, there usually isn't a therapist. There's usually people getting together. And I know when women, like, like I facilitated women's circles or healing circles in general, self-help circles.
Mhm.
And even if there's a facilitator or co-facilitation, what's happening is the community is healing itself because the hierarchy is not really there. We are equals and we are humans and we're here to heal together. So that's a major thing that I do
Mhm.
believe has been erased from our cultures. And even though we try to, there are so many sisterhoods and brotherhoods and community where people are coming together, one of the things that we often do not talk, I mean, I think the conversations are happening depending on the circles, but we're not talking about how trauma, like greater trauma, we're talking, and I was looking at some research and it was talking about that Black women had higher impact, like were highly impacted, disproportionately impacted by fibroids, but so are Asian
Mhm.
Chinese women in America. Hispanics and white women have lower incidence. And when I was reflecting on what is it about our societies, we and I think about commonalities. I know high performance, high achievement, the drive to care for our like, and I can only speak for my experience and what I've observed, but the responsibility of being a caretaker and then also taking care of ourselves and thinking more about, how our responsibility is not just for the I. So in the like I know I can speak for myself. Growing up, and even now I still struggle because the US is very individualistic, but what happens if you're not from a community or society that has those same values? I was looking at this meme or a video on Instagram where essentially it was this little girl who comes out, her dad has a hanger, he's about to spank his son, and this little girl comes, she brings chairs, makes him sit down, she brings her brother something to drink or something, and then she takes the hanger from her dad and throws it out. And I was looking at the comments because the videos are always like great, but the comments also give a different perspective, right? And the comments were like, oh, she's parentified and all this stuff. This is like a 2-year-old child, and oh, how, all this stuff. But in reality, what I see coming from a different perspective, my culture is different, and it's not just about, parents have to discipline their children, whether he
Mhm.
actually got
Mhm.
spanked or it was just a fear tactic. There's this element of discipline. But in
Yeah.
addition to that, you have this little girl who's just like, okay, like, y'all need to chill out and daddy, please. And she gives her dad a hug, and then takes her brother. So there's like all of these layers, but the reality is from a young age, I know that I was taught as the oldest daughter to take care of everyone. So
Mhm.
when we're looking at that, the stress of responsibility, and I don't demonize it. I don't look at, oh, I'm being parentified. It's just like in the real world, we all
Mhm.
have to take care of each other and we all have
Mhm.
roles. And yes, our parents are adults and they have their roles, but really, even as a little human, a child, we still have our obligation to learn how to be responsible and
Mhm.
respectful. So,
Mhm.
maybe her brother was totally disrespectful and was just being checked. We don't know the backstory, but all these people are coming in with their little emotions and judging the parent. How dare this parent do all this stuff? But like the reality is, like we all have to survive. We all like, and especially when you're a minority, they were in their own country.
Mhm.
But like I know as a minority in America, there is a fear of not being able to make it. Like there's a fear that you can be taken out, right? You can be killed. We
Mhm.
see what's happening with immigration. We see all these horrible things happening. Now imagine living
Mhm.
in fear and you also are responsible not just for yourself, but the safety of your family and the expectation of not getting in trouble. Like there's just so many layers that other
Mhm.
people, like a lot of people don't even think about that I
Mhm.
realize like we this just makes the stress heavy. So when you're
Mhm.
dealing with stress, I mean all of that to share all this story to talk about stress, right? So the level of stress that I feel is a major factor that we are not discussing. And the
Mhm.
stress and the multi layers of it, the multifactorial aspect of it without judgment, because there's
Mhm.
always this imposition of one cultural ideology over everybody else's culture, as if this
Mhm.
Western perspective is the only way. And that's only one perspective. Like Western medicine and the
Mhm.
narrative of conventional medicine is one
Mhm.
perspective of health. But
Mhm.
then you have
Right.
all of these other aspects of health that are often
Mhm.
not even acknowledged.
Mhm.
So,
Yeah.
like these are things that we're talking about, but the stress. So, when we're looking at stress, so the reason why I think stress is a major part of it is because we talk about estrogen dominance. I know as in
Mhm.
naturopathic medicine, a lot of our education, when we're talking about endometriosis, we're talking about uterine fibroids, we're talking about most uterine dysregulation. We're looking at estrogen dominance, but where's that dominance coming from? Because for a lot of us, when you measure our estrogen are within normal limits, right? So
Mhm.
when we're looking at it, it's not necessarily, it's relative to progesterone. And why
Mhm.
is progesterone low? Well, because the precursor of progesterone is the same as the precursor for cortisol.
Okay.
So if you're stressed, your body is not going to really, it's like we're not trying to get pregnant in this. We're not
Mhm.
going to be trying to create reproductive hormones. We're going to try and activate the nervous system, the fight or flight system. But
Mhm.
instead of, again, we talk about this all the time, instead of we're running away from tigers, this is everyday situation where we have exams, we have school, we have bills, we have maybe you come from a dysfunctional family. Maybe you come from a normal family, but there is that need to survive that we're all struggling with right now, unless you're part of the wealthy demographic or a very privileged few who are protected against, what the economic issues that most people are facing, right?
Well,
So,
there's the isolation too, just like you were saying with community, the isolation issue that we have. I was actually thinking about this morning traditional, you know, um, people, cultures, right? They lived in communities, right? We call it, why it would be considered communes. Oh, you live in a commune. And I'm like, that was actually healthy. I was
yeah.
out there talking, and I kind of talk to the trees. Some people might think that's funny, but when you're in nature, you commune with nature, right? And I was just looking at this land that was just they just bulldozed the trees and then it's just left. I'm like, why did you take away the trees that the animals that was their homes? It makes me so mad. But anyway, I was thinking about, Western civilization, and I was also looking at, the manicured lawns. And I said, this
Mhm.
is the problem with man, right? God and environment and nature is about diversity, right? And that's where a healthy nature is in diversity, is in work in living together in um that equality you were talking about. There's no hierarchy, who's better, who's worse, or whatever, who is the leader and who's not your leader at a time that you need to be the leader. They work together. Traditional communities were so much more healthy because they respected nature. That tree stayed there. They respected, yes, they ate the animals, but they didn't do it was like
They
they
didn't
would think.
overkill.
Right. And so there was community. And again, I was talking to a group of mine talking about, females versus males, the hunter versus the gatherer in these communities. And why men and women think differently is because their roles were different. And women with so much, they have to be in a community driven thing. They were the gatherers. They had to communicate because they had to look at the things and say, talking to the elders that were teaching the youngers, this is what you look for, because if you miss this specific detail of this plant, you're going to kill
Yeah.
somebody because you're going to get a poison instead of an herb that's going to be food or a medicine. And even in those that are considered poisonous or toxic, there is an amount that can be, medicinal, but you had to talk about it. And so they would talk with one another and they would compare things. And so women are very much community. If they're not given that opportunity to talk and to look at things and to be made sure I didn't miss a detail, because women are so detail oriented because they had to be under a gatherer's mentality, right? Because I have to look at that leaf and know that leaf is in this certain shape. Men couldn't do that because they have to look through the trees to the prey, right? To the thing. And so also they
Or
were,
they chose not to.
yeah, because they had to get to the deer that's through the trees. So paying
Yeah.
attention to the trees, they're going to miss the deer. But the woman, they had to know that, and also they were the caregivers. So there was a neurologist that was speaking on the difference between man's brain operation and woman. A woman is very much in the forebrain, and she's in the limbic system. So she's very detailed, very much thinking, reasoning, and she has to have that compassion to be the caregiver, the healer, the ones to raise the children, to be able to emotionally connect. And again, if you think about a man that's hunting, if he's looking at the deer, he's going to be like, I'm killing the deer. Woman's going to be looking at, oh, it's such a pretty deer. I don't want to take out the deer, And
Yeah, that's
so,
so true. Well, some
so
women, they don't
but the
mind.
woman, yeah, but the woman has to have connection. She has to have that. And that's what we're missing in our communities and why women are so stressed. They said men are 17 times more likely to be in jail or incarcerated than a female because she has that limbic system operation and the forebrain. So I saw this other meme. It was talking about this guy who was watch these guys. They made this little car into like an airplane, and then they flew off and they crashed, of course, into the water. And the guy goes, thank you, wives everywhere, because this is why we need wives. Because if we didn't have wives, we're doing this stupid crap over here. You keep us on the ground. And so, so showing the difference between men and women and why women have to have that community is so that women are twice as much, 2 times more likely, I would say higher than that, more likely to get depressed than a man, by the way. And that's because she is trying to communicate with somebody, and that our isolated communities where everybody has a house and nobody talks to their neighbors anymore, that they have become disconnected. And she's trying to talk to the husband, and he's like, what you're talking about? I don't care about the details. I don't even know where stuff is at half the time, you know? And so, like you were saying, women, and I mentioned earlier, for women to experience their bodies appropriately or to understand that, they have to talk. They get very easily nervous about it. Right?
Yeah.
Is this right? Is this wrong? Should I be acting like this? Should I be acting like that? And I had somebody text me yesterday about some reaction she was having to something. And I was like, yeah, that's. I said, yes, this is probably such and such and such and such. And she texted me this morning and says, thank you so much. She says, I was able to sleep last night because I realized I wasn't going crazy. And, again, that's the same deal. We going through these, she's going through, the change of life, and it makes a woman feel like she's going crazy. And so
Yeah.
understanding, okay, this is what's happening in your body. These are the things that are probably off. These are how we can get it back on track, and the same when they're trying to have children and they're so, high strung in that
Overwhelmed.
stress, and they
Yeah.
don't have that community to help them to relax their body back down, to have an older person that's been through that to say, hey, this is what's going on. And it just makes you feel like, oh, I can sigh, but I'm not crazy. Oh,
Yeah,
this
you
is
can
what's going on in my
relax.
body. And
Yeah.
so we're missing that community. And that's one of the things I kind of encourage people. I was like, if you need therapy, I really would recommend you going to a group therapy more so than just a one-on-one. Sometimes you do need that one-on-one therapist. I said, but I think the group therapy is more beneficial because you get what we used to have in traditional cultures is that
Community.
understanding you're not alone. Others have been through this. These are things that they got to do and gives you different perspectives how to approach that problem or that issue, or to just say, hey, you're normal, so to speak, or there's others that have been through this trial and know how to help you out of it and to be able to fix your body. And that, just that alone, a lot of times can actually help women to overcome infertility issues and actually relax their body enough to be able to conceive. You know, we're talking about reproductive health, and in that aspect of infertility is just being able to go, oh, I'm not I'm not crazy. I think that's a lot of times for women is one of the big
Or
things
even
that.
the pressure of so the pressure of conceiving or getting pregnant,
Mhm,
because
mhm,
you know a lot I don't know, talking to my mom today was just like, it's there. I recognize how much pressure there is. And I mean, now my mom is like in her mid 70s, so the pressure isn't there, but we
mhm,
talk about things, and as she shares some of the experiences she had around her reproductive lifespan and relationships, it's that the pressure of making sure that you if you want to have children, that having children, and especially with the stresses now, women are not just staying at home. It's like your
mhm,
responsibility is also part of, like, we do have careers. And it's like,
mhm,
even when you're talking about the hunter and gatherer, there's roles in society where
mhm.
no, it wasn't like, oh, she's a stay-at-home wife. No, honey was out there getting food just like you. It's just a different type
Exactly,
of food. It's like food and
exactly.
gathering medicine. So women
Mhm,
have always been contributing to the household, contributing to society. The way that we're
mhm,
doing it is different, and the pressures that are weighing on us are also different. So, and without the structure of community. And
mhm,
so it's interesting because I was looking at a lot of the signs and symptoms of like uterine fibroids. They talk about constipation being a major symptom.
mhm,
And the question is, do fibroids cause constipation, or the constipation is there contributing to the estrogen dominance, right? And so it was interesting because I went down a rabbit hole. We're scientists, even though we do practice other forms of medicine. I went and I
mhm,
started really thinking about the metabolism of estrogen. And I
mhm,
really don't know if we talk about the metabolism of estrogen. So estrogen, like a lot of the hormones, are created in our body, but they also have to be excreted or released from our body. So everything that's created in our body, even as I said, the blood cells that we have, they get recycled. So they get broken down when they're not useful. So after 90 to 120 days, your blood cells usually are broken down. And if they're
yeah,
not properly formed, they get broken down as well, right? The body is very efficient. So what happens with estrogen is the metabolism occurs mainly in the liver,
mhm,
and what we know is that when there's constipation and it's excreted through your bowels or
mhm,
urination, right? And I think a lot of it actually is excreted out of the bowels, more of it's
mhm,
through the bowels than through the urine. So if
mhm,
you're constipated, and constipation can happen due to stress. Some people get diarrhea, some people get constipated. So
mhm,
constipation could actually be due secondary to stress. We also know that there's also the progesterone is lower because of stress. So you have two factors that could be happening due to stress, an external factor that has nothing to do with the reproductive system, but can
mhm,
be triggered by so many things. It could be performance, it could be relationships, it could be, am I good enough? It could be all these other things that are going on. Like I have a deadline, whatever, or my family is stressing me out. And the constipation in itself is keeping estrogen in the body that needs to be excreted. And there's not even in the most, sometimes it's not, it's supposed to be an inactive metabolites, but some of the inactive metabolites are they're like carcinogenic.
mhm,
And so I was looking at like where are they formed and which of so the CYP enzymes, CYP
mhm,
450, all the enzymes,
mhm,
they're cytochrome based. So these are part of the oxidation reduction pathways. And then
Mhm.
there's like, this is why we take antioxidants. Let's be real. Antioxidants
Mhm.
help with reducing oxidative stress. So there's so many things that we can do to help support. So liver support is one of the things that, when we're talking about the reproductive system, the liver is the main, I know in East Asian medicine, that's the main organ system that is being supported.
Mhm.
And when we look at some of the herbs that are used to that actually are used in the Western materia medica, or within Western herbal medicine, in
Mhm.
the East Asian medicine, they are liver supportive herbs. So they help the liver and to move the liver qi. So
Mhm.
Vitex, for example, which is huge. Vitex is it's a herb that is used to help regulate estrogen and help with excretion and the balance of estrogen. It is also called, oh God, it has so many names, and my brain is like, let's not waste time thinking about Um, but Vitex, for example, and even Black Cohosh, they
Mhm.
are in the liver, like they support liver qi.
Mhm.
And in the Eastern Material Medical, they're not even used as we would use it for women's reproductive health. So
Mhm.
again, when we're looking at it from different perspectives, we're supporting the liver. We're
Mhm.
helping the liver to excrete. We're helping the energy of the liver to be moved and moving the stagnation. And when we're
Mhm.
talking about aspects of pain, we're looking at chi stagnation, right? And if we're looking at liver chi stagnation, usually the liver is where the reproductive, it has, because it holds the blood, it stores the blood. It's very big in the reproductive system, that in the spleen, as far as reproductive health for women's health. And so that chi stagnation, when the energy just kind of gets stuck, you can have pain. We also, like, we're talking about the metabolism of estrogen and the elimination of estrogen not happening as optimally. But we also see that cortisol levels tend to be higher in that state. And
Mhm.
so, looking at it from that perspective, supporting the liver is a major part. But from a Western perspective, one thing that is very protective in women's health that is under discussed is vitamin D.
Mhm. Yep.
And I think about why vitamin D, and I know, all right, so as a Black woman, there's a lot of colorism, and even in communities of color in general, where
Mhm.
people don't want to go outside, like because
Mhm.
of the
Mhm.
racial
Yes.
hierarchy
Agreed.
of color.
Mhm.
The
Mhm.
lighter
I've
you
seen
are, the more
Mhm.
privileges historically have been.
Mhm.
And
Mhm.
so there is a vitamin D deficiency is high, even in places where there's enough sunlight. So how do we get vitamin D? Is spending time in the sun. This our sun. You have to
Mhm.
do it with the strong enough UVB, I
Yeah.
believe. And so in Australia, they did this amazing study that showed our shadows. If our shadows are 2 to 3
Mhm.
times the length of our bodies, then we're not getting enough UVB.
Mhm.
So if you're going
Yeah.
outside and you can see a long shadow, then you've missed your mark. So you should be going outside and spending, yeah, like the sun, you definitely, you want to be moderate, especially if you don't spend time outside. Don't go out and spend an hour or longer when you don't go outside ever. So at the high times when the UVB is the highest, maybe spending 10 to 15 minutes a day, 30 minutes ideally, a day, getting the UVB rays will get you the vitamin D that you need, because our bodies actually produce it through the skin absorption.
Mhm.
And you want to expose, it's not like go out in your little shorts or anything, but you do want to make sure that enough skin is exposed, especially on the legs and the arms. So those are, you can get enough of the vitamin D production from that. But you could also, I mean, supplementation is big, but it's not the same.
Yeah.
And realistically, there's research showing that supplementing every day, especially in higher melanin skin, it's still not
Mhm.
producing, like you're not seeing changes in vitamin D levels. So, what there's also a study out of Australia. They were Africans who migrated to Australia who were deficient, and they were using high dose vitamin D. So if you're using if high dose vitamin D once a week, but working with a medical practitioner, just because there is a fine line where your vitamin D can be too much, and you want to be mindful, like, but even the norm is low, right? We want it to be around 50 NGs per
Mhm.
DL. Oh, God, I think that's the
80.
measurement.
Mhm.
We want
Yeah.
it to be 50. And that 30 is a little too low. And so even with patients, when they come in with 30, I'm still, that's great. You're not super
That's
deficient, but we're trying to get you higher than 50.
yeah. Yeah, I know there's some functional practitioners that say it needs to be 80 DL,
Yeah.
NGDL. So, that's a bit. I was at 23 when I was here when my last check on vitamin D. But, the thing about vitamin D, people don't realize why it's associated with endometriosis and fibroids. Why? Because vitamin D helps in differentiation of blood cells, which is really prominent in endometriosis, because endometriosis is cells that's formed in the wrong place. They're uterine cells that are on your mesentery, or it's on the exterior of your uterus and onto your other places in the abdomen, because it was not properly differentiated. And that's a vitamin D action along with vitamin A. Those two vitamins are very important to differentiation of cells. When cells are reproducing or being developed, if we don't have those markers that say, hey, it's like, I'm in the proximity, so I guess I'm supposed to be a uterine cell. And it's like, no, you're not quite in the right place. The vitamin D wasn't there to say, no, you are supposed to be a mesenteric cell. You're supposed to be a small intestine cell. You're supposed to be the wall. You're supposed to be this, that, and so that's why, and I found that very fascinating, because I was, observing at the clinic, and somebody had come in and she had endometriosis, and I noticed that she was very pale. So a lot of people that can't make melanin can't convert vitamin D, so
Mhm.
they can be vitamin D deficient, or they don't have it. They're so pale. Then I'm like, you haven't been in the sun, which means your vitamin D is low as well. And I'm thinking about
Yes.
this, like, oh my goodness, vitamin D and differentiation. And so I went and did the research. I was like, I wonder if vitamin D deficiency is associated with endometriosis. So this is how I came. And I told it, like, yes,
Yes, and the
endometriosis is
fibroids as
highly
well.
associated and fibroids, because that is, again, your body is not knowing when to turn something off, or to know,
Yep.
hey, you need to be cutting back, which is the T cell activation of vitamin D. And that's what causes
Yeah.
autoimmune conditions and cancers, is because T cells are not doing their job of surveillance. And that's what
Yeah.
fibroids is an overconsumer. It doesn't mean it's a cancer. It's just I overgrew because somebody didn't say, hey, stop,
Yes,
you know,
yes. Yeah,
and
the
differentiation.
regulation is
Mm-hmm.
off. Yeah, and I feel like, so that's the thing. It's like vitamin D, I know conventional doctors do, like, they know the importance of vitamin D, but then there's always this, like, if it's the right, if it even has a place. But we know, we saw during COVID, like, let's be real, majority of people
Yeah.
who had long COVID or had
Mm-hmm.
more of the complications of COVID actually have vitamin D deficiencies. And so by
Right.
having the adequate amounts of vitamin D, we know it's a pro-hormone, but it also has immune supportive
Mm-hmm.
aspects. When we talk about vitamin D in school, the focus is usually on the bone metabolism, but bone
Mm-hmm.
metabolism is only one function, and there's so many aspects of the vitamins that are beyond just what we're told. And it's kind of like,
Mm-hmm.
why is hormones so important is because there are estrogen receptors on a lot of aspects of the body. And the more
Mm-hmm.
that we do, even this, that we recognize that these hormones, their target may be one area, one organ system, but the reality is there's feedback mechanisms. And then there was also, I was looking at this study that was saying, that even with the metabolism of estrogen is controlled by estrogen levels. So
Yeah.
estrogen actually controls its metabolism in some cells. And so whether you're going to have the antioxidant, the one that's a little bit more protective against against cancers, or you have the one that is more aggressive and pro-cancer, is based off of the body's ability to metabolize the proper amount, and then also which of the enzymes are turned on. So if we're stressed and the body is producing estrogen in different places or metabolizing it in different places, and the target organs are having more control, and it's not the liver. So if you have that liver qi stagnation or congested liver flow, so like your circulation
Mhm.
is poor and the portal veins are kind of congested, the blood flow is not circulating
Mhm.
well, then you can find that the body's external, so periphery, the
Mhm.
tissues outside, so that's where your breast tissues and other tissues, there's so many tissues
Yeah. So
that
irritation.
are metabolizing it, but they metabolize when they're breaking down estrogen, they're actually creating more of the cancer pro-cancer
Mhm.
component and not the one that's protective against cancer. So for me, liver health is so important, which is why simple
Mhm.
things like castor oil packs are
Mhm.
important because we
Mhm.
are moving lymph. We're moving, it's like when we're moving the lymph, the blood will also move. And so
Mhm.
helping to move the flow of the fluids in our body. So exercise, how many people like exercise and movement? Like we talk
Even
about,
so.
yeah, even a massage. Oh my gosh. Okay, so I'm not in the US. I'm in Korea right now.
Yeah.
And part of so there's the conventional medicine and then there's Korean medicine doctors, so traditional medicine doctors and then the Western medicine doctors. And they coexist. Insurance covers a portion of their care. So if you're using acupuncture, you're moving the chi, the flow, the movement of blood, improving circulation. But even the traditional medicine practitioners, they also do body work, right? It's moving
Mhm.
the circulation, promoting circulation. And these are things that we have lost. These are
Mhm.
privileges in the
Mhm.
West. We're
Mhm.
having resources. And when you're a student, who's getting a massage? When you're
Yeah.
stressed out, who's getting a massage all the time? I mean, I love massage. When I'm
Massages are
stressed out,
important.
that's what I would do. But not everyone thinks, oh,
No.
let me go get a massage. Let me go to a yoga class. Let me go and just move my body.
Yeah. So I was speaking with my niece yesterday. We went to breakfast and stuff, and we were talking about westernized societies and the disconnect. We were talking about that disconnection again, and we were talking about touch because touch is so important. And it's talking about how in Western world, um, any type of touch is now construed as sexual touch. It's taboo,
Inappropriate. Yeah.
right? And so that's why there's so much taboo, I think, in going and getting a massage, right? And so people don't readily go there because, again, any touch is considered that when it's not the case. I mean, we need touch. Touch is so important for oxytocin. That's why there's so much more aggression in Western society because touch creates connection and that creates a kind of that again the oxytocin, which makes you happy. It makes you want to care for one
Bond.
another,
Yeah, the
bond.
bonding.
Yeah. And so the in societies where there's a lot more touch, and I've read I think it's in the book that I'm reading. I think I don't know if I mentioned here. It's called Job's Body. He talks
Yeah.
about the difference between societies that hold their children more, that cuddle and give each other hugs, that their crime rates are considerably lower, their aggression rates are very very low, as opposed to the ones that kind of put their kids in a papoose and sits it on a limb while they go and do their work rather than putting them on their back like they used
Yeah.
to with
Yeah.
their children, and they'd gather and they'd be on their back and they'd be going along, and the little
My
kids,
mom used to do that with us. She'd just
right,
take cloth and tie us on her back.
right. And so in Western medicine, it was so, they go off to boarding school. You had a nursemaid or whatever. Of course, that was higher society. But even in the lower, it was like, and I hear it all the time. Oh, the kid, you need to put them down if they're crying. Don't pick them up all the time they're crying. Crying is how they communicated. When they stop crying, then you've made there's a problem, when they can't cry to get their needs met anymore. And it
Mhm.
creates that disconnect and they can't, I was talking to another person, it was a few years back, where she worked in the deaf school here in North Carolina, and there was a young man that was deaf, and he also was put into an orphanage at a young age. So he had no contact and he had no connection, and he would go around and stab people. He was very aggressive, and he didn't have any understanding. So he was very aggressive, and they found it was associated with the fact that he was never hugged as a child. He wasn't given that ability to connect because he was never given that hug. And so it's very fascinating, to think about that, is where we're at, is we need that. And so moving the lymph and moving the blood, not only is that helping us to get rid of those toxins, to get rid of the bad estrogen, but we're also giving the nervous system the stimulation it needs to go back into the rest and digest and the connection that we needed, so that our body can go, oh, and it's amazing to think something so simple as that has been taken away from us has created such a society that we have today.
And it also impacts, I think these things, so like, it's so weird. We started talking about reproductive health, and we're talking about how, like, some societal, like, the condition and the environment of our society, right? And I think it's important to look at the environment in which we live and how it impacts our health. Because I
Mhm,
know in naturopathic medicine, we talk about environmental medicine as a major component of treatments, looking at like, I know before we talked about this, endocrine disruptors and other aspects of our environment, but we
mhm,
can when we're talking about the environment between us as human beings, the relationships that we have, our ability to have healthy community, healthy
mhm,
touch, to feel
mhm,
comfortable, to feel safe, to
mhm,
be able to walk down the street and not fear your life or that something bad is going to happen. And being in so having this conversation and being in South Korea, where I walked down the street, and even though I'm a foreigner, I don't really speak the language. And I mean, sometimes people may look at me differently, but like, people are so kind to me overall. Like, people are still kind to me. Like, and I see, even though there are, like, you see that the signs of isolation, people are on their phones, we're just that people living in their own little spaces, there still is aspects of community that I see, like a lot of people spending times in coffee shops, a lot of people going, it's just like, even if you're studying, I was in a coffee shop, there are people just sitting at like one large table, just studying and doing what they need to do. So there's less of that. And then also going to restaurants where it's like a farm table, and you sit down, and yeah, there may
mhm,
be a whole party next to you and down, but it's just like, I had random conversations with strangers
mhm,
because it's it's a little bit more communal, even if there is aspects of individual pockets.
mhm,
And so that safety, though, is the one thing that I recognize as a major difference, and the ability to breathe.
mhm.
You know, I think that it's important that we really look into, we look beyond just the science, but we're looking at how our societies are created. We're looking at the
Mhm,
systems, the structural
mhm,
racism. We're looking at patriarchal infrastructures. We're looking at isolation as a means of capitalism. And,
mhm.
it's not to demonize these structures, but I think we should be having conversations about how do we um, prioritize the health of the people versus the health of the other, or the business, right? The people should
Right.
matter first.
Right. It's the balance. Like you said earlier, there's no black and white, because socialism we've seen fail as well
Or
as capitalism.
communism.
Right.
Yeah.
So it's those two extremes of it. You still have the elite in it. It's where we come, like you said, it is coming back to saying the people are always the proper. I was reading an article about a gentleman that, in a capitalist world, a true capitalist world is where you put your people first, and then it's going to come back to you. It's better to give than to receive. But when you give, you receive. And so there's that, thing. Instead of making everything, what's the word I was talking to my sister?
About the
Self,
self.
the self.
Yeah,
Yeah.
self, preserving self-interest
And
over
so
the greater good.
you have, yeah, finding that balance between it. That's the thing that we do in Chinese medicine, right? It's about balance. It's about
Mhm.
balance. And our society doesn't have balance, and if we would bring it back to balance and community, I call it, you know, it's a community driven if mindset that should be there, and not a self mindset. And I know we were talking about reproductive health, but in reproductive health, all of these factors factor in to the body being able to do its function appropriately and in balance. So when we're out of balance, all the other things tend to flow with it. Again, we have stagnation, we have deficiencies, we have,
Dampness accumulation, because
Mhm.
really we didn't talk about the patterns because I know
Yeah.
we're trying to be mindful of time.
Yeah.
Um, but the accumulation of dampness, right?
Mhm.
Because that's really when we're talking specifically with even fibroids and endometriosis from a Chinese medicine perspective, we are looking at pathogenic damp. So
Mhm.
we're looking at the body's inability to metabolize fluids well and excrete the fluids that are building up. So whether it is due to a deficiency like vitamin D, or
Mhm.
it's due to chi stagnation, allowing poor circulation, somewhere along the pathway, there's an accumulation of this damp and cold in the body that needs to be excreted.
Mhm. Yeah. Okay.
I know it's just so much
Yeah.
to
Yeah.
even digest. And, you know, I think this is like really like so many of our conversations, the beginning of the talk.
Yeah.
Because as we've even looked at and discussed, this is a multifactorial aspect where
Mhm.
maybe the external environment trumps over the individual's health, and being able to shift that the perspective where we're looking at health not as an individual's experience, but health as a
Right.
community and the global or as a national issue. And how do
Mhm.
we prioritize that? How do we shift it so that our health isn't an afterthought or not even thought about, or it's disease. The disease experience becomes the reality that now we have to change things. When in reality, I like if you follow my social media, you see, like I do post pictures of like where my experience is. It's like imagine going outside, having access to workout equipment in
Mhm.
parks everywhere that you go,
Mhm.
being able to have access to green space, because
Mhm.
we know that where there's more access to green space or even the ocean and things like that, natural nature, that there's
Mhm.
actually improved equitable health. So
Mhm.
if we're prioritizing people's well-being and their health, then we're actually creating environments. We're not destroying land. We're actually preserving the land and allowing people to be able to access equitably the nature
Mhm.
and health, access to well-being, not just, and fresh, healthy foods like non non-injected, not excessive GMO and all that. Like actually food, like our animals are well taken care of and they're not eating inflammatory foods and causing us to be inflamed. Because
Mhm.
that's where, and then the other side of it is like either heavy pesticides or now, it's even what is quote unquote organic is it could be highly processed or sprayed with something that isn't real. So all
Mhm.
these environmental factors impact our reproductive health.
Yeah. Yeah.
Yeah. Someone should uncover. Well, I'm glad that we
Yeah.
had this conversation, Joanna.
Yes. Well, hopefully we can get together again and kind of expand a bit more into some of the other areas, that is challenging our reproductive health. I think today we really got into the kind of the big picture, and maybe we can bring it on down, getting into some of those, uh, you know, scientific ones too. Well, we talked about like the chemical things and stuff. Today, we talked about the stress, which is one of the biggest factors I think that we have in our
Mhm.
society, but also, as you just pointed out, the environmental ones too that we can chat about next time for our audience.
All right. Well,
Thanks for
thank you
listening.
so much for tuning in to the Mindful Table. And I hope that you will join us again for our next discussion on reproductive health and just other aspects of day-to-day living with a mindful lens.